each speaker. Our next speaker, Jim Baumgardner, is the Deputy Assistant Director in the Congressional Budget Office, and he's been there since 1994, and he's worked on many policy issues involving government health programs and federal regulation of the private sector health plans. He's actively involved in much of CBO's health policy work. And before joining CBO, Jim was an economics professor at Duke University and received his Ph.D. from the University of Chicago. So please join me in welcoming Jim.
Thank you. Thank you, Paul and Margaret, for having me back. I can't answer all of John's questions because I got interrupted by technical issues with the microphone, and I didn't hear the whole second part of what you were saying, John. Although the first part was correct, though, about, more or less, about the employment-based insurance. We had originally, I think, a $3 million reduction in employer-based insurance due to the ACA. And now I think was $7 million, whatever figure John had. So we have gone up in that, and a chunk of that is that with the now lower marginal tax rates that will be in current law under the Taxpayer Relief Act that I'll talk about in a few minutes, there in essence is less of an implicit subsidy to offer employer-sponsored insurance when tax rates are lower, since it's a tax-shielded benefit. So that is part of the reason. Also, we'd improved our methods for calculating what the base of employer-sponsored insurance would have been under current law, and that caused us to go up in what it would have been, and then out of that bigger base, so for a certain percent under a bigger base, you get a greater number reduction. So that was a piece of that as well. And I missed the Medicaid part, John, sorry. How many people were here 2 years ago? Oh, wow, okay. So the people who weren't here 2 years ago, after this, you'll think I'm a nut, and those who were here 2 years ago who know that I am. I had to share this email with you. This is to James Baumgardner, that would be me. Importance high. And this was sent Thursday, February 14th, 2013. That was Valentine's Day. After additional tests on Wednesday morning to review the severity of the issue, it has been determined that Lady Gaga has a labral tear of the right hip. I don't make this stuff up. That's why it's so funny. This is true. I'll continue. She will need surgery to repair the problem, followed by strict downtime to recover. This, unfortunately, will force her to cancel the tour so she can heal. For your convenience, we've automatically refunded your order. So, anyway. So Monday night, it was going to work out, unlike 2 years ago when I had the difficult decision of speaking here or seeing the concert. And of course, I knew where my priorities were. I was going to see it Monday night this year because Paul worked with her scheduler and got it all worked out. And well, the best laid plans sometimes don't work out. So anyway, I have way too much to talk about today. So let's go. So my comments are off the record, not for attribution. There are two parts of my presentation today. For the first few minutes, I want to talk a little bit about a study that I have been very involved in at CBO for about 2.5 years, and we published it in June. It's on our website about excise taxes on cigarettes and their effects on health and the federal budget. You guys are my home away from DC, and since this sucked up 2.5 years of my life, I got to tell you about the study. But I think it also, I'll relate it to the bigger federal budget stuff, which will, of course, then be the rest of my talk. So let me talk about this project. So often at CBO, many directors have heard complaints from senators and other members of Congress that, you don't give us enough credit for the things we've done to improve health and take that into account, and that's going to lower healthcare spending, and that's going to, really get rid of our budget problems, maybe even. So why aren't you doing that? Now, in part, we always have done that, but we wanted to do a really thorough study that really traced something through that had health consequences. Some policymakers have argued, boy, prevention, if we just did more prevention, that would solve these fiscal problems. So that's kind of the motivation for why we did this study, where we wanted to trace the full consequences on the federal budget of a policy that would improve health by changing people's behavior. So what we did, we took a 50-cent increase in the federal excise tax on cigarettes. Unlike how this is usually written in law, we assumed it would be indexed for inflation and growth in income and average income. And then we wanted to focus on how would that change outlays and revenues. And through the path, obviously you're going to raise excise taxes on cigarettes, you're going to raise revenue that way. But we also wanted to trace out the effects on health and then how those effects on health would affect the federal budget generally. And we wanted to look at not just the 10-year budget window, because people, I think, correctly argue with prevention and the like, it's going to take more than 10 years to see these results play out. So we wanted to take a long-term view as well. The caveats there, we're not dummies. Obviously, there are other considerations besides the federal budget. I mean, if people are healthier, it obviously, that matters too. Other stuff matters besides the federal budget. But, the job here was let's look at the effects on the federal budget. So that's what we're doing. Other things like trying to do things with obesity and the like, who knows? I think you really have to study these things to figure out the exact consequences. But here we really took it, a painstaking effort that in the end involved, I think, up to 40 people at CBO, many of whom no longer work at CBO, were on this project. If you look at the acknowledgments section of this study, you'll see I wasn't kidding what I just said. There were a number of casualties along the way. Okay, so I'm doing this to remind people of a key problem. And this, just look at the bottom line. The lime green is basically the primary deficit. And this is our June 2012 projection. The last time we did long-term projections was last June. But, in this decade we're in now, you could say, well, this isn't that bad. But the real acceleration occurs in the next decade, the 2020s and the 2030s, is when that primary deficit really decays. And that's the whole baby boomers getting older and issue, and they're on Medicare and Social Security, and there it is. And so 2035, I just want to keep in mind this number. About 7.5% is the estimate, and this is not under current law. This is under typical policy that has been followed over the last several years. So that's the problem, 7.5% of GDP in 2035. I'm going to come back to that later to get an idea of the magnitudes here. I'm going to go really quick through, there's a lot of great detail work in this study, and that's the kind of thing I like, but I'm not going to bore you with it. So I'm going to bring you high level and the results and then move on. But here's a look at at the effects of smoking on healthcare spending. And this is by age group. And basically, people who have current or former smokers are the red line, and then I have two different ways of measuring people who haven't smoked, and then this econometric construct, people who have never smoked but have the other characteristics of smokers. So they have the lower education on average and lower income on average and higher drinking on average of smokers. But if they didn't smoke, what would their spending be like? And that's the green line. So if you can compare the red versus green line, you could say, well, roughly that's the effect of smoking on healthcare spending per capita. But if you notice as people age, if you compare, in any age group here, so I'm looking at that green line, so someone who hasn't smoked, but their spending is still certainly much higher than a smoker of a younger age group. So that's important in understanding the results you're going to see. And it also leads to a profound lesson in all this. Smoking's bad for you, but getting older is even worse. Again, something that is totally true, and it's a good laugh. Okay. On mortality, you see the same thing. In any age group, in many of these cases, a smoker's twice as likely to die, but as you get older, yeah. So we're looking at, there's sort of three main avenues to think about here. Okay, people are healthier, so their healthcare costs are less. People are healthier, so they're less likely to die. And then the final one I want to talk about has to do with earnings. People are healthier, and their earnings are higher, and higher earnings on average means higher tax revenues from those people. So we wanted to take that into account as well. And in fact, let me just get to the bottom. So, they retire later if they're not smoking. They participate more in the labor force when they're younger. There's also evidence that they're more productive, less absenteeism. So we concluded in the end that policy-induced quitting would increase earnings on average by 4 to 7%, depending on a person's age. Okay, let me just get to the bottom lines on these in terms of effects on federal spending first. So here's Medicare. So this was a policy that was going to start in 2013. And in the short run, indeed, there is a reduction in health care spending. You've gotten some people to quit. They don't have that heart attack. They don't have that stroke. And we do get some reduction in the fairly short term for the first, say, 15 years of the policy approximately. But there's a tension. There's a tension between that reduced spending because people are healthier, but it's the mortality thing. Longevity increases. More and more people live to be Medicare beneficiaries and to be older Medicare beneficiaries when the costs really start rising, even for someone who's never smoked, as we saw in some of the earlier pictures. So in the longer term, really, Medicare costs rise under such a policy, and that just continues to grow over time as the longevity effect dominates. Medicaid is a different story in the new exchanges under the ACA. There we had savings throughout the period. It's a different population. You have relatively more young people in Medicaid. You have expectant mothers who are less likely to give birth to a low birth weight baby. Those are the kinds of things on the Medicaid side that give you savings throughout the whole period. Social Security, and it's going to be true of other pension programs, look, people are living longer, they're collecting for longer. It increases cost to have a reduction in smoking. And we did take into account certain offsets. So, for instance, fewer people collect survivor benefits on that dead spouse who smoked. So that kind of thing was taken into account here. But nonetheless, the Social Security costs do rise over time. So we put it all together. We had a bunch of other programs: civil service retirement, military retirement, DOD healthcare, supplemental security income. We tried to turn it upside down to add all this up. And then here's our total effect on outlays. So this is outlays, spending by the federal government. At first, there's savings, but after about a decade and a half, spending rises. Okay. How about revenues? Well, revenues rise with healthier people who are working more. There's an effect of longevity. They have a longer working life. The productivity arguments I talked about. So the red line is the total effect on revenues from the improvements in health. So right now I've left out the big enchilada is you have higher excise tax on cigarettes, you collect more in excise tax. So that's out there, and I'll come back to that in a minute as well. But first, just the health effects. If we just looked at the health effects and not the excise tax on cigarette effects, here's the revenue line, here's our outlay line. On net, we did get a reduction on net in the deficit for most of the period we looked at, although ultimately the longevity on those Medicare Social Security programs in the long run sort of won in that tug of war. But I want to talk about magnitudes here. 2035, the reduction in the deficit, that's 0.005% of GDP. You compare that with that 7.5% number I spoke to you about earlier. We're in a different ballpark. And then if I have add the excise tax now, so now the revenue line's way up here, and it's always a decrease in the deficit because I'm taking into account the excise taxes now. So that in 2035 is like reduction like 2.5% of GDP. No, 0.02 0.0225% of GDP, the reduction in the deficit. So I think the bottom line of all this is small stuff, though, in budgetary terms, I think is one point. So it would take, even if you include those extra taxes on cigarettes, that revenue, it would take 300 policies like this to get rid of that 2035 deficit. And if you just look at the health effects, it would take 1,000 such interventions. So this is small stuff in budget terms. Nonetheless, it's there. And we did conclude you'd have 10,000 more living people in 2021 than otherwise, and 63,000 more living people in 2035 than otherwise. I think there were interesting patterns on spending. It depends on who's the target of the program. For spending on the elderly, those end up costing more when you get rid of some smoking. But for things that target a younger population, you get a reduction in spending. And then finally, the revenue picture was interesting, I think, as well, and the revenue increase was as significant as the outlay increase, really, in general size. Okay, I am moving now to my other stuff, the bigger federal budget picture. And I ended last time with a picture like this. I think I had a different color scheme, but it was a picture like this, although this was updated in June 2012. And, you know, we've lived in this world of two realities, or I don't know, maybe only one of them was a reality, but the so-called baseline scenario in blue, which was current law, that's if current law is followed and laws aren't changed, this is debt as a percent of GDP, what that picture would have been. And this is June 2012, before the Taxpayer Relief Act. So a lot of the reason this was dropping was tax rates were going to go up, the Bush tax cuts were going to expire. That was current law. But, you know, the theme every year is, yeah, but current law is never followed. What about what usually happens, which is the tax cuts get extended, the cuts to Medicare physicians don't happen, those type of things. And that's really what this alternative scenario is, the red line here. And that's the one that, you know, things look bad, you get to Greece, we're Greece by 2030, this type of thing. And I left last time by saying, well, let's see for the year 2013 how we move off of that red line. You know, are we going to move down into the poor choice of colors here, but we move down into the red area or not? Or are we going to even maybe move up? What's going to happen? So as best as I've concluded, which is not easy, and this is a Jim Baumgardner back-of-the-envelope calculation, we have moved down into that red area by less than 1/4 percentage point of GDP. But remember what they taught you in elementary school? A line has no width. A line has no width. So keeping that in mind, which way did we go? We did go below that red line by less than 1/4 percent of GDP in 2013. And where did that come from? Well, it comes from the American Taxpayer Relief Act of 2012, well, 2012, but I think it was passed January 1st of 2013, I think, or at least by one body, the final body that passed it. And basically, this was the act that averted the fiscal cliff. That's what this act was. And as you see here, it racks up to adding about, so negative means increase the deficit. So it added $4 trillion to the deficit relative to current law. Now remember, current law had all the Bush tax cuts were going to expire. And basically, as was mentioned earlier by Jim, this act basically codified or made permanent the Bush tax cuts except for single taxpayers making more than $400,000 and married taxpayers above $450,000. So their tax rates went up, and that's the basis of my calculation that we did come down off that line. That's the element that changed. Other things here, the Medicare line here is so physicians were supposed to get well, under current law, they were going to get a 27% reduction in fees as of this past January 1st, but that was just flatlined instead, so the cost of that are these two numbers, basically. Well, really the whole row, although there are other Medicare changes embedded in that as well. Okay. Let's talk about the deficit this year. So last year we ended up coming in just above $1 trillion in deficit, about 1.1 trillion. So this year, for the first time since, well, we'll look at my next figure, I forget which year, but I think we've had 3 or 4 years in a row above $1 trillion in deficit. We expect it to be $845 billion this year, continue to improve. As Jim mentioned earlier, economic recovery is the main part of this story, so continued reduction in deficits. But as you get to the out years, the baby boom stuff is what you're seeing. The baby boomers retiring and becoming a significant part of spending. Okay. Let me bring something up because I have to bring it up sometime. So let me bring it up now. So this is our current law projection, and it includes we basically reduced our projections on Medicare and Medicaid spending this year. And to give you an idea of the size of that reduction, basically if you looked at the year 2020 and compared our projection in 2010 with our projection today, we've brought Medicare and Medicaid down by about 10% for the year 2020. And part of what we've been seeing is growth rates in Medicare Parts A and B, for example, have been 2.9% since 2009, compared with 8.4% a year between 2002 and 2009. So this slowdown has been going on for a few years, and our forecast has been above the actuals, and so we finally had to bring this down. Anyway, talk to me sometime. We're trying to figure out what's going on. You folks are in the business. Is this a transitory thing, or is this permanent? And what's the cause? I'd be curious to hear people's thoughts on that. This is as a percent of GDP. Deficits as a percent of GDP. Again, they're coming down because of the recovery, but after 2015, they start to move up again. The baby boom entitlement story. This is just historically to get an idea of deficits as a percentage of GDP. Yeah, it was 4 years in a row we were above $1 trillion, and really unprecedentedly high, except if you go back to the World War II years. And now we're finally this year expecting to start to get back into at least some place we've been before. And then this is federal debt held by the public. This is under current law. So this is under new current law where, again, the Bush tax cuts are in for everyone except those above 400K. I also should have mentioned that Taxpayer Relief Act, January 1st, permanently indexed the alternative minimum tax for inflation. So that song and dance I did every year about the AMT, and next year 30 more million tax-paying units are going to have to pay it. That was taken care of in perpetuity, well, unless the law changes again, but this act permanently changes. So it's not a thing to go through every year like the Medicare physician fix is still in there to go through every year. So this is current law, and again, the debt's falling at first, economic recovery, but rising again, and look for our publication. It should be late June, early July of this year will be our new longer range projections. But the underlying fundamentals for growth are there, and even if healthcare costs, even if that growth rate comes down, you just have these issues like, what is it? It's something like a 50% increase in the retiree to working age population, that ratio. So those fundamentals are still sitting out there. It's a little bit like going to the Oracle, and the Oracle says, you're going to be in this terrible car crash, and every bone in your body's been broken, and now you're going back again, and this time the Oracle says, well, it's not going to be quite as bad as I had said. Well, that still leaves room for something that's not very pleasant, I think. Okay, the sequester. I need to talk about the sequester. So starting March 1st, unless current law is changed, the sequester will take place, and this shows basically the cuts in various parts of the budget that would be triggered for the remainder of fiscal year 2013. Again, by the agreement, what's in current law, half comes from defense, 42.7 billion, half comes from non-defense, 42.7 billion. You translate that to a percent of those areas, though, it's about an 8% cut in the defense budget. And then here, Medicare by law, it's limited to 2% for Medicare services. A bunch of stuff's off the table. Medicaid and Social Security are protected. But other non-defense discretionary stuff, like the Congressional Budget Office, the Public Health Service, the National Park Service, all that stuff. NIH would be 5 to 5.5% cuts. And oh yeah, if you want to rack that up, that's about 0.5% of GDP. So if you want to know how far below that red line do we go further, if this full sequester stayed in place, it would be about 0.5% of GDP. Of course, it may not stay in place. Some fraction may stay in place. It may be replaced with other cuts. Under current law, here's the projection for various programs. I know I'm running out of time, but there's some important stuff here. I'll try to say it quickly. So on the major healthcare programs, about 0.75% of GDP increase here is due to the new provisions in the Affordable Care Act, the Medicaid expansion, and the exchanges. You see defense and non-defense discretionary spending dropping. That's because the sequester caps plus the sequester brings these down. And these are basically historically low levels once we get out beyond like 2016 and beyond. That's a post-war low for defense. And I only went back to 1970 and looking at the non-defense, but it's since then, once you pass like 3.3% of GDP, that's lower than that has been as well. I want you to watch this one. Net interest. This is interest on the debt. This is sitting out here. Right now, interest rates are, well, Jim had this too. They're at historic lows now. And you know, the 10-year Treasury is, I think, under 2% now. You know, we think it'll be like 5% in, I have the year scribbled somewhere in my notes here. I think it'll be over 5% by 2018. And that causes a substantial increase in what our interest payments are going to be as a percent of GDP. Interest rates returning to historic levels rather than this unusual period. And just to put this in perspective, here's one of my on the airplane calculations. Actually, I did it before I got on the plane. But in 2013, as a percent of federal outlays, payments on the debt, interest payments on the debt were 6.3%. What we're projecting for 2023 is that they'll be 14.4%. Well, in 2013, net Medicare as federal outlays is only 14.1%. So this is something that's sitting out there. And if interest rates would go back to normal level, more historic levels, it starts to take a significant chunk out of the federal budget. Okay, last set of slides. So this shows the deficit under current law. And I just want to show you kind of the alternative scenario, things that have been typically changed in the past. Gives you an idea of alternative paths. So under current law, at the end of this year, so starting January 1st of 2014, physicians will get about a 25% reduction in the fee schedule. If instead Medicare physician fees were held constant out till 2023, Sorry, we forgot to put the axis on here. Oh, no, we didn't. There it is. I forgot we had flipped a 0 at the top. You know, back in the old days when I used to come here, we actually had positive parts of this. And we had 0 around here, but we've moved the 0 up here now. But anyhow, that would be the difference. If you froze physician payments instead, obviously there are slight increases in the deficit because you're overriding what would be cuts. So that's that alternative. This is if you canceled the sequester. If you canceled the sequester, the deficit would increase by these amounts. There still are tax provisions out there. Most of these are in the realm of business taxes, but there are still things that typically get extended for a year or two at a time. And they're set to expire next year or the year after. Things like accelerated depreciation, research, and there are like 300 of these credits out there. Anyhow, if those get extended, that would also increase the deficit. And then finally, I've added all 3 of those things in there. So under an alternative scenario, here's the deficit picture. Again, we've got improvement because of the economy rebounding, but then these structural, I think was the word, structural problems. And actually, if you went back to my debt picture, I think that had debt over GDP in 2023 ending, I think, at 77% of GDP. Under this alternative scenario, it would be 87% of GDP in 2023. So it would add about 10 points to that. So big dates that are coming up, not Monday night's Lady Gaga concert, but some big dates coming up. March 1st is when the sequester starts. So the next couple of weeks are going to be a scramble. It'll be interesting to see what happens there. March 27th, I haven't talked about March 27th, but March 27th is when the continuing resolution expires. So basically all the discretionary programs in the federal budget, there's no provision after March 27th. So the government would shut down March 27th on the discretionary side unless some further resolution or appropriations are made to continue through the fiscal year. And then May 18th is another date. May 18th, the statutory limit on the federal debt, that issue comes up again to extend the debt ceiling. So at any rate, it's always a good time to come out here and thank you.